Agarwal. She has been trained and has worked in India and in the UK with NHS. She is licensed by the Health Professional Council and as such has gained valuable education in advanced therapies during her tenure of work in England. She has a bachelor's in physiotherapy from IPGMER SSKM Hospital, Kolkata, and a postgraduate diploma in preventive and promotive healthcare from Apollo Hospitals, Hyderabad. So we are very happy to have you with us, Dr. Anjali. And today and tomorrow, we'll have a session with her and she'll be talking about pelvic floor physiotherapy for women's health. So I request every one of you who have joined us through Zoom, Facebook or YouTube to please post in your question and answer questions regarding this session. So we can also take your questions in tomorrow's session. So please stay tuned and I hope you'll all be benefited with the session today. So before we start this, I would request, has Ashuji joined?
Yes.
Okay. I would request Ashuji to please start the session with the morning prayer.
Good morning, everyone. Dr. KK sir के चरणों में बार-बार प्रणाम. ओम भूर्भुवः स्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो नः प्रचोदयात्. तूने हमें उत्पन्न किया, पालन कर रहा है तू. तुझसे ही पाते प्राण हम, दुखियों के कष्ट हरता है तू. तेरा महान तेज है, छाया हुआ सभी स्थान. सृष्टि की वस्तु में तू हो रहा है विद्यमान. तेरा ही धरते ध्यान हम, मांगते तेरी दया. ईश्वर हमारी बुद्धि को श्रेष्ठ मार्ग पर चला. भगवान हमारी बुद्धि को वेद मार्ग पर चला. Thank you, everyone.
Thank you, Ashuji, for starting our day with such a melodious prayer. So over to Dr. Anjali. I would request you to start your talk, please. Ma'am, you're muted.
Right. Good morning, everybody. Welcome to Health Darbar and a very, very happy Monday to all of you. Today we'll be going towards a very good topic and a very important topic which every person in the household should look into. Women's health and the role of pelvic floor physiotherapy. Pelvic floor physiotherapy has been a very late concept which is coming back to healthcare practices, and we are helping women get back to activities of daily living without discomfort prenatally, postpartum, menopause, and also late menopause. So what is women's health in and the role of physiotherapy when it comes to pelvic floor physio all throughout the ages of the women? So we have a role of pelvic floor physio when a woman has PCOD. जिन women को PCOD है बचपन के दिनों से देखा जा रहा है till the time they get pregnant and when they deliver the baby and post delivery the baby they have postpartum issues. उसमें भी role of physiotherapy का काफी महत्व है. Now, what are the criterias which we look at in women's health is why is the women getting an issue when it links with urine incontinence, why she's feeling feeling of constipation, or she's feeling any back pain, tailbone pain, and any kind of pains associated with pelvic floor has to be treated by a pelvic floor physiotherapy. Now, in the women's health section, we see the women is delivering a baby, they never referred for postpartum care. Okay, so what is the issue when it comes to postpartum care? A woman has a big tummy and she's delivered the baby. She has to go on to lift the baby, look after the baby, feed the baby. So a lot of activities gets added on to her lifestyle, which she's not been doing. Now, with that, the kind of pressure which the spine has to take, the kind of pressure which her tailbone and her overall bodily systems have to take is too much. But the importance of postpartum care was never there, like 15, 20 years ago. So if we look at all our grandparents and mothers, they were fitter mothers because they were very active during those times. But as we see the present generation, or the generation maybe 10 years, 15 years down the lane, they were never able to do a lot of activities during the pregnancy, while they were pregnant, and also postpartum. Now, the body has a lot of role to play when it comes to being actively involved in taking care of your pelvic health. So, pelvic health का सबसे बड़ा important role होता है to make you stand. What is the role of a pelvic floor? जब आप खड़े होते हो and gravity is pulling you, those muscles help you to stand the best as you can stand without pain. The pelvic floor is supporting the spine. आपका जो spinal column है, pelvic floor supports it. And also it supports the multiple organs of your body, which is your uterus, your organs in the tummy, which is your intestine, your stomach. All these things are being held by a hammock. एक झूला जैसे structure होता है, which is attaching right below your hip area. And when this is attached, these muscles are protecting your organs from down below, and they play a very, very important role to have a very good hip health, spine health, and overall tummy health also. Now, देखते देखते मैं we are seeing that the more sedentary these women are becoming, the pelvic floor gets affected. Sorry. So the pelvic floor is something which gets very, very tightened जब women are sitting for long, and if they're lifting too much weight in a day. So अगर आपका जो weight है उस हिसाब से अगर आप weight नहीं उठाएं, बहुत heavy lifting कर रहे हैं, चाहे आप gym में कर रहे हो, and you're doing vigorous activities without taking care and without strengthening of the pelvic floor, women lead into a problem called pelvic floor dysfunction or urine incontinence or fecal incontinence. तो ये सारे issues हम ज़्यादा आज के ज़माने में देख रहे हैं because first of all the activity quotient of the women has come down. So the inactive women will have a very tight pelvic floor or a loose pelvic floor. और जिस तरीके से हम hip replacement के बाद, knee replacement के बाद, we tell you should do a knee physiotherapy or you should do a knee rehab, we should be advocating in all the hospitals and all the birth clinics that women please do take and consult a pelvic floor physiotherapist or a women's health physiotherapist, because जो problem आज आप जल्दी solve कर लेंगे वो आगे चल के आपको hip replacement की तरफ नहीं जाना पड़ेगा. As I said, pelvic floor is the door, is actually a door for your other organs and other spinal columns of the body. It is like a protective covering, like a small hammock-like structure down below your hip, which is protecting you from all the wear and tears of the body. अगर वो muscle को हम strengthen नहीं करेंगे and we don't look after the health of that muscle, then we see a lot of issues with prolapse, uterine prolapse. So uterine prolapse क्या होता है? As and when women age, post 40, 45, and 50, and when they near menopause, the organs like uterus and a lot of interuterine structures starts to come out of the lower portions of the pelvic floor for a woman. So women को लगेगा there is an extreme pain in the pelvic floor. There's a lot of incontinence. She'll always have a feeling of dragging down her back. She'll feel that there is something pulling down her legs. और जैसे वो खड़ी होती है तो उसको लगता है कि उसकी प्रॉब्लम नी में है या हिप में है या टेलबोन में. बट कई बार ये जो प्रॉब्लम्स हैं ये हमारे वीक पेल्विक फ्लोर के कारण होती हैं, जिसको हम लोग ध्यान नहीं देते हैं राइट टाइम पे. सो व्हाट डू यू मीन बाय राइट टाइमिंग? सो when a woman is pregnant, when the woman is pre-pregnant, those time also you have to condition your pelvic floor, because it's not that automatically just when a woman is pregnant that we should be identifying the cause of pelvic floor dysfunction and we look into what has happened wrong with the women. But आधे से ज्यादा समय तक हम अगर pelvic floor पे पहले से ही ध्यान दें, बहुत पहले से, जैसे कि women is growing up, just growing up age में अगर spine health अच्छी है, अपना spine का curve अच्छा है, अपना sitting posture is good, we are active, we never cause compromised pelvic floor. And as a result, when the woman is pregnant, women kaise बैठ रही है, how she's walking, how she's kind of lying on the bed, how she's kind of evacuating, matlab, is her bowels open, is her bowels being very clear, constipation तो नहीं है, बहुत जोर लगा के आप अपने emotions तो pass नहीं कर रहे हैं. ये सारी चीज हमारे pelvic organs और pelvic floor को affect करती है. And same thing in case of men and women, the pelvic floor दोनों cases में होते हैं. And in both the cases, you have to look after your pelvic health by means of maintaining pelvic health hygiene, maintaining good optimum nutrition, good optimum sleep, good amount of hydration, and also a good amount of exercises, which has to be done in a careful manner. तो आधे से ज्यादा time in the prenatal period, जब women pregnant होती है, the growing weight of the baby puts a lot of pressure pelvic पे. तो जो हमारा जो hammock जैसा जो structure है, उसमें weight of the baby बहुत जोर से pressure देने लगता है. As a result of that, the women's spine, the women's other organs also get compromised with the structural changes which is happening during the pregnancy time. And the women gets a posture which is called as a lordotic posture. उसमें क्या होता है, जो spine होता है वो हमारा आगे की तरफ बहुत curve होता रहता है, and she has like a hollow back at the back because of the growing weight of the fetus which is drawing forward. Now, as a result of that, women always complains of lower back pain or tailbone pain or pelvic girdle pains. Now, ये pelvic girdle pains इसलिए आते हैं because our pelvic floor is getting too tight or too loose. So during the pregnancy, हमारे hormones जो progesterone और relaxin release होते हैं, उस कारण से जो हमारे ligaments हैं बहुत weak हो जाते हैं as a time for women to prepare for labor. So the pelvic kind of expands during the time of the 8 to 9 month. And that is the time the pelvic floor gets compromised. उस time पे जो हमारी pelvic floor या तो काफी tight हो जाती है या काफी loose हो जाती है, depending on situations, depending on person to person, women to women. And as a result, what happens is if the women has not taken care during the pregnancy of the pelvic floor, आधे से ज्यादा जब वो birth करती हैं, तो we see that they're not able to have a normal birth. Why? Because the pelvic floor has become so tight because of the structural changes. They did not take care of the postures which kind of compromise the pelvic floor. That can affect their situation of having a normal birth. और अगर normal birth होता भी है, तो many of the time there is a trauma which comes to the pelvic floor. So birth has happened in a very rapid way, or it has happened with a forceps delivery. You know, like they have to use a tongue to pull the baby out. In all these situations, the pelvic floor gets little damaged or get traumatized. अब जब भी कोई भी event होता है, चाहे C-section और चाहे normal delivery, हमारा जो pelvic floor है is compromised prenatally. And as a result, we will have to see a pelvic floor physio during the pregnancy to help the pelvic floor becoming good, not very agile, very flexible, at the same time, not too tight, not too flexible. A medium way to have a good pelvic health. And now post the delivery, जब baby बाहर आ जा रहा है, you have to see the pelvic floor physio right from day one of the delivery. So ये concept has to be introduced in all hospitals. मैं जितने भी hospitals में देखती हूँ, we see the women who has delivered the baby right from the time of 1 hour to 2 hours of her delivery. Why so? Because it is like a trauma which has gone to a pelvic floor whenever a woman has delivered and the birth has not gone as planned. And as a result of that, either the pelvic floor gets a little damaged or distorted, and there's some procedures like episiotomy is happening, or there's a first degree or second degree tears which can happen on the pelvic floor. अगर इन सब चीजों पर हमको we have to get lot of blood flowing in that pelvic organs right from the time she has delivered. So एक concept होता है, we as many of the gynecists would say that do a Kegel exercise where you tighten your pelvic floor, stop the pee and flow of the pee and the poo. वो एक कॉन्सेप्ट था पहले के जमाने में, बट आजकल मॉडर्नाइज टाइम्स में व्हाट वी एज पेल्विक फ्लोर फिजियोज एडवाइस देते हैं कि हर women should be assessed by a pelvic floor physio, then only the Kegel advice should be given, because all women are not equal, all muscles are not equally tight or loose. So some women have a very tight pelvic floor, उसके लिए we have to give reverse Kegel. तो हमको tighten the pelvic floor नहीं करना है, we have to work towards relaxation of the pelvic floor. And उस दौरान कुछ women जिनका pelvic floor बहुत loose हो गया है and it is having no tone, and that time we'll give them Kegel exercise, which is tighten the flow of the pee and the poo. Imagine that you're stopping the flow of the pee and the poo. But what is important to understand is that every person is different, every birth is different, and as per the pelvic floor assessment, that your pelvic floor physiotherapist can design your program as to you require strengthening at level of 10 or you require level of 20, what kind of activity modifications or what kind of postural modifications will be needed to help you with the pelvic floor issue. Once you've delivered, you've seen a pelvic floor physio, वो आपको अच्छे से rehab बताएंगी, जिससे जो आपकी टमी की मसल्स होती हैं, कई बार क्या होता है, women feel, आधे से ज्यादा women को लगता है कि प्रेगनेंसी के बाद बड़ा टमी होना is a common thing, but there's a misconception. Every woman जिन्होंने भी deliver किया है, the tummy if it's bloated till now, they should look for a pelvic floor physio and उनसे evaluate करके ये पता चलना चाहिए कहीं tummy muscle में separation तो नहीं आ गया है. What is this tummy muscle separation? So when the baby grows in the uterus during your pregnancy time, जो tummy muscles होती हैं वो भी separate होके baby को room देती हैं around the front. Now as you progress with pregnancy, ये जो tummy muscles हैं वो lose होते 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 और lose हो जाती हैं. And once you've delivered, after 6 weeks postpartum, ये muscles को वापस आ जाना चाहिए. So if the doors have opened of the tummy muscle, they should close back. But many of the time, these muscles are called rectus abdominis. They should close back, and there's a thin tissue in between these two tummy muscles. They become very loose during the pregnancy. इसको हम linea alba बोलते हैं. अगर ये muscles loose होके बंद नहीं हो रही हैं and is prolonging after 6 weeks, we call the term, it's called diastasis recti. इसमें क्या होता है, women will say कि my tummy is big, there's a hollow in my tummy. जब भी मैं हाथ छूती हूँ अपने navel पे, the tummy is just sinking in. और या मैं जब उठने की कोशिश करती हूँ तो tummy is doming. तो tummy एक हिल के आगे की तरफ protrude होने लगता है. Many of the time women say that I've got umbilical hernia, and doctors will say, okay, go get the surgery. But the misconception or the myths which I will burst is every umbilical hernia doesn't need surgery if you have delivered, and diastasis recti can happen both in men and women. And ये मसल्स को वापस लाने का काम pelvic floor physiotherapy में हम करते हैं. And it takes couple of weeks and couple of months. And if you have not taken care of this, it can affect your whole biorhythm. And what is a biorhythm? Many women will complain कि मेरे को बहुत back में pain रह रहा है. There's a shooting sciatica kind of pain which is going down from my hip down to the toes and the legs. कई बार वो लोग बोलती हैं कि I feel lot of pain in my tailbone and I feel indigestion or I feel constipation. I might feel that they might feel that when they cough, there's a leak of a urine. So ये सारे kind of phenomena women में देखे जाते हैं postpartum, and they might start to see these symptoms coming 8th to 9th month of their pregnancy also. उस टाइम से अगर वो pelvic floor physio या women's health physio से मिल लेंगे तो ये सारी problems solve हो जाएंगी. And if you keep prolonging this problem and don't pay attention, and it is prolonging for 10 to 20 years, तो क्या होता है कि spine, knee, hip सब में असर दिखने लगता है. So many women 1 month, 2 months और postpartum मेरे पास आके बोलेंगी, मैम मेरा नी जो पटेला है, नी का कैप है, बहुत अटक रहा है. बार बार मैं जब चल रही हूँ, इस shooting pain is coming. And I feel there's a lot of pain in my hip and there's a lot of sciatica pain. So the normal physiotherapy में जो equipment based therapy modalities लगा के जो treat करेंगे knee को, hip को, उससे हमको कोई आराम नहीं दिखेगा in सब cases में. Why? Because the root cause of the problem जो है हमारी tummy muscles बंद नहीं हुई है. और अगर tummy muscle बंद नहीं हुई है, it's like a door, right? It's covering your organs, various organs of your body. And if that is not there, your whole core is imbalanced or compromised. That will cause problem to the hip, to your spine, to your pelvic organs, everything will get compromised. So we will have to find the root cause of the problem, which is the diastasis, treat the diastasis, and we can see a significant change in the women's pain perception when it comes to managing sciatica, managing knee pain, managing any kind of headaches, migraine pains, lot of issues can come. तो ये हो गया हमारा प्रीनेटल एंड पोस्टपार्टम. प्रीनेटल प्रेगनेंसी टाइम में पेल्विक फ्लोर फिजियोथेरेपी का बहुत बड़ा रोल होता है. वी हेल्प women to have a healthy pregnancy. And to have a healthy pregnancy, they need a very good pelvic floor strength, and they need a very good alignment of their spine, their hip, and their over agility and mobility. And during the pregnancy also, they might have back pain. A lot of women complain of pelvic pain. Ki, doctor, I'm not able to cross my legs. I'm not able to turn in the bed. ये common issues in women को देखे जाते हैं. And when these women have these issues, they always complain that, ma'am, I'm not able to walk. Ma'am, I'm not able to sleep at the night. So these are pelvic pains. ये भी pelvic floor physiotherapy के तहत. And if you can solve anything there and then, the problem will not fall towards later on during your birth and labor. And now the second thing and the third thing which we see is during the menopause. जब women menopause पे पहुंच रही होती हैं, तो वो लोग बोलती हैं कि मेरे हिप में काफी पेन आ रहा है डॉक्टर, and I feel a dragging sensation down the pelvic. And उस टाइम पे we always say कि women का uterus या तो नीचे आ रहा है, and doctors will say you'll do a surgery kind of thing to pull the hip up. But with pelvic physiotherapy, we can prevent surgeries, we can prevent complications associated with uterine prolapse. So women get a very good benefit by reversing the urine incontinence. उनका जो problems है कि खांसते ही उनको leak हो रहा है urine, वो भी stop हो जाती है. So this is a small gist which I've given, and I think we can end the session and we can be open for questions. Thank you.
Thank you so much, Dr. Anjali, for such an informative session. I think आज के लिए we'll have to stop because of the time constraint. एक ही question है ma'am आज. If not taken this therapy after delivery, is there any advantage taking this therapy after 3.5 months?
Exactly, we can do that. After I have patients who are about 65 and 55, जिनको hip replacements भी हो गए हैं, ठीक है? तो वो लोग अभी वो therapy ले रहे हैं, because पहले के time में उनको ये पता ही नहीं था कि these therapies were there, they could have prevented their hip surgeries. So I always say the word is postpartum is every time there is a postpartum. So postpartum मतलब post delivery ही नहीं होता है. Lifelong a woman who is delivered is postpartum. तो आप कभी भी इस प्रॉब्लम को सॉल्व कर सकते हैं. There's a remedy for it. थोड़े बहुत चेंजेस जो स्पाइन और हिप में आ गए हैं, उसको भी हम रिवर्स कर सकते हैं थ्रू द पेल्विक फ्लोर फिजियो. So good pelvic health, the motto is the pelvic health is your prime indicator for hip surgeries and knee surgeries. About 80% of the knee surgeries and hip surgeries can be prevented in women अगर वो postpartum अपने ये postpartum health पे ध्यान दे पाए. Thank you.
Thank you, Dr. Anjali. We are looking forward to your talk tomorrow as well. So thank you so much for joining in today, and thank you everyone. So please join in tomorrow again for a continuation to this session. Thank you. Thank you, ma'am.